The long-term consequences of regularly consuming ultra-processed foods are not limited to isolated health problems, but extend to an overall reduction in life expectancy. Multiple large-scale, longitudinal studies have now drawn a clear link between diets high in ultra-processed foods and a significantly increased risk of premature death. This disturbing association arises because ultra-processed foods contribute to a constellation of chronic diseases, obesity, type 2 diabetes, cardiovascular disease, cancer, and more, that collectively shorten lifespan and degrade quality of life. At the heart of this issue is the nutritional profile and chemical complexity of ultra-processed foods. These products are typically high in added sugars, unhealthy fats, refined carbohydrates, salt, and a wide range of artificial additives while being deficient in essential nutrients like fiber, vitamins, minerals, and antioxidants. This imbalance promotes metabolic dysfunction, systemic inflammation, and oxidative stress, key drivers of chronic disease development and progression. Studies following tens or even hundreds of thousands of participants over years have consistently found that those who consume the greatest proportion of ultra-processed foods have a markedly higher risk of all-cause mortality. One such study published in the British Medical Journal tracked over 100,000 adults and found that for every 10% increase in ultra-processed food intake, the risk of death increased by approximately 14%. This risk remained significant even after adjusting for other lifestyle factors such as physical activity, smoking, and socioeconomic status. The reasons behind this heightened mortality risk are multifaceted. First, ultra-processed foods contribute directly to obesity, insulin resistance, and hypertension, conditions strongly linked to heart attacks, strokes, and other fatal cardiovascular events. The high levels of trans fats, sodium, and added sugars in these foods exacerbate blood vessel damage, promote atherosclerosis, and impair heart function. This creates a vicious cycle where diet-driven metabolic dysfunction rapidly leads to fatal cardiovascular outcomes. Second, the increased cancer risk associated with ultra-processed food consumption plays a significant role in reducing life expectancy. Research indicates that exposure to additives, chemical contaminants, and the poor nutrient quality of these foods may elevate the risk of several cancers, including colorectal and breast cancer. Cancer is a leading cause of death globally, and dietary factors like those found in ultra-processed foods are now recognized as modifiable contributors. Third, ultra-processed foods contribute to chronic kidney disease, liver disease, NEFLD, and other organ damage that silently diminishes health and resilience over time. Many individuals with these conditions die prematurely due to complications such as kidney failure, liver cirrhosis, or infections. Because these diseases often progress without symptoms, people may not realize the damage until it is too late to reverse. Beyond the physical health effects, diets high in ultra-processed foods may also influence mental health, leading to increased rates of depression and anxiety. These conditions can impair individuals' ability to maintain healthy lifestyles and adhere to medical treatments, indirectly worsening health outcomes and mortality risk. Importantly, the impact on life expectancy is not limited to any one demographic or region. While lower-income populations may be disproportionately affected due to greater reliance on cheap, ultra-processed foods, these products are ubiquitous in modern food systems globally, making the threat widespread and urgent. The message is clear. The habitual consumption of ultra-processed foods is not merely a dietary preference, but a powerful determinant of premature mortality. It accelerates the onset of debilitating chronic diseases, erodes organ function, and undermines the body's capacity to heal and maintain homeostasis. This creates a cumulative burden that shortens lifespan and compromises quality of life. Addressing this issue requires systemic change, including improved food policies, better regulation of food manufacturing, clearer labeling, and public health campaigns promoting whole, minimally processed foods. Individuals must also recognize that long-term health and longevity depend heavily on dietary choices and the avoidance of foods designed more for convenience and profit than for nutrition. Without urgent action to reduce ultra-processed food consumption, the growing epidemic of diet-related chronic disease will continue to claim millions of lives prematurely, exacting a profound toll on individuals, families, and healthcare systems worldwide. The promise of longer, Healthier Lives hinges on breaking free from the grip of ultra-processed foods and embracing diets that support true well-being from the cellular level to the whole person.